So, a good successive all sessions to the learners come effectuators. I am Yogesh Patel from GRY Institute of Pharmacy, going to cover the brief reason of osseous system, which is also known as skeletal system. So, typically, skeletal system is basically a or acute backgrounds of the body which is making the strengthful equities of the body. So basically, what are the strengthful equities of the body? So the things which is not being unmatchable through the listings of the strengthful things. So how the scenario in that and how the syllabus curriculum is telling us to do so we are covering those things over there. So basically osseous system is categorized in two types, basically axial system and pandicular system. So axial system is just growing the midline of the body to sort out which things to equal. So basically it is a head, where head is conclosing. We are showing the specific parts of the slide in that. So this is the basic curriculum of the syllabus we are pointing out to turning it to the next. Osseous system is basically the definition, and then types have different type of osseous systems categorized as a skeletal system. So now the slidation period is the function of that particular system. So basically it spurs the momentum. As you all know, the baggage part of the body is basically the unsorted. So it supports the actual movements of the body. So second is the protection. It is actually protecting the interior things, which is actually erythrocytic formative lanins basically. So mineral homeostasis. So you all know that the electrolyte level in the body is just favorable to note what kind of body is energy we are demanding. So for that level, we are infusing some sort of the electrolytic essential trace elemental overviews inside the body. So basically, it strengthens the protective acquisitions through the mineral hemostasis. Blood cell formation. Basically, I already told that the protection is actually protecting the bone marrow masses, so, which is actually a red bone marrow masses. It's a pale yellow coloration bone marrow masses, and there are several type of bone marrow masses, which is actually a specific part of what we are not having. So, on the background of RBCS, it's actually a WBCS or either platelets and vice versa or other formed element of the blood. Triglyceride storage. So basically it is a glyceridic entities coming out after the metabolism from the liver, and just after the filtration equity we are talking about the kidney. It's about the pair of kidneys filter out the intoxicants, which is listed as creatinine and some sort of vice versa things. So after the formation of hematopoiesis, erythropoiesis, monopoiesis, leukopoiesis, is basically the formation of RBC, WBC, platelets, and vice versa. Is the thrombopoiesis is actually the formation of the platelets, or there in the linings also we are have to talk about in this slide. So shifting the slides, I'm having the material in that. What's the functionality? This is the basically diagrammatic projection of the skeletal system, which is categorized as axial and appendicular. So basically the bluish part is covering the midline of the body, which is the axial skeletal system. Start the golden is having the particular section. So shifting the slides, the visual interfaces, structure and function of the axial skeleton. So basically, what are the functions, executive functions? As we all know, the flexion, dorsiflexion. So dorsiflexion basically the appendicular system. So the structural inputs of the axial system is what we are all know, that the 80 bones are there in the axial skeletal system. So bones are actually positioning as axially. That is why the proportionate of the axial skeletal system is constituted with the help of these 80 bones. So primarily it may be facial bones, it may be cranial bones, it may be ethmoidal incision bones, where the neck bones is there. So it may be maxilla, it may be mandible, okay. So it may be a cervical bone, any of the inthroatputs. It may be a rib cage, it may be sternum, it may be vice versa things which is covering the axial bones. So facial bones are those bones which is covering the frontal fascioptera of the face. So cranial bones is basically just behind the posterior linings of the head, is covering the cranial section. So I'm shifting the slides for the next material to you. This is the diagrammatic visual interfaces we were talking about previously. The material based, it's actually the visual interfaces which is showing different types of bones over there. So this is the cranial bone section, facial bone sections. We are already viewing the frontal, parietal, temporal, occipital, and all the ethmoidal bones is covering the exterior incisions of the nose. I'm not talking about the concurrent situations of the facial bones. Okay, so now it's actually the position is same. So those are the bones which is covering the superficial section, which is actually a frontier. So that is the frontal bones. Parietal bones are actually covering the F and well situations or positions of the face. Sphenoid bone is actually the deblurred bones, okay, which is constitutional equities of the other unsorted things. Zygomatic bone, vomer bone, these are maxilla, mandible, these are the movable and unmovable part. Okay, so shifting the slides for the next material to auditory ossicles. So this is another excelling part which is interior linings of the ear actually. Okay, so when we are talking about the ear, we are talking about the ossiculary pinna. Okay, so those pinnas having these three smallest bones of the body, although we are not talking about the largest bone which is actually femur. These three are the shortest, smallest concussions of the body which is categorized in the osseous system. So malleus, incus, and stapes. Okay, so stapes is forming basically the audio auscultative auscultation over there, which is actually a hearing inputs of the body. So these are the auditory smallest bones of the bodies that are forming and constituting the things. Shifting the bones higher is also higher, discovering the neck section just beneath and below over the superficial part of the cervical section. We are covering this what we are having on that. So the vertebral column is concluding the cervical, thoracic, and lumbar vertebra. This is the posterior sections of the body. When we are talking about the thoracic vertebra, it's just a superficial, supraanomic things. Cervical is also the neck. Lumbar is concluding just beneath the lumbar region. We are talking about lumbar region. It's gone through part of the back edge of the lumbar region. So these are the vertebrae covering different type of bones on that. Basically 80 bones are there, and that all the axial system concluding what the sort of things. Okay, shifting the slides for the next material to you. This is the visual interfaces of those sections we are already talked about. So this is the sections covering the hyoid, mandible, larynx. It's a cervical region basically. These are the captivating structures of the anterior and lateral views. So this is a section covering the upper nomial, cervical, the medianomial, thoracic, just less rotative lumbar, sacrum, and coccyx regions to detach. Shifting slides to next material to you. Thoracic cage. Although this is the last part of the axial skeletal system, which is actually 12 pairs of the parallel lineals enclosing all the thoracic cages, and organomimetic enclosing is listed as lungs and heart. Basically function though the intercostal muscles are there in the thoracic cage to expel and impel the gaseous exchanges with the help of diaphragm. So we are not going to fetch what we are not talking about. The pathophysiological incisions are there in that. So the next stop is sorting out to be the great pathogenetical principles overviews over there. What the pathogenetically diseases arises in the thoracic cage. So basically 12 pairs or parallel pairs are there, which is constituting the thoracic cage actually, and it is terminal part of the axial skeletal system. So thank you all the learners, come specified persons. We are gearing up in this channel and channelize the learning content over there. I am Yogesh Patel, concluding the axial skeletal system or the osseous system part of the where all the students and learners, scholars, and all over the places to gain what they are wanting to be. We are covering next topic as a appendicular osseous skeletal system in the next section. So till then, it's a huge fusive bye to all.